Maine free CNA practice test with answers 180 questions real practice. Question 1. Which of these is the least likely to signal impending death? Option A, the increase in appetite. Option B, labored breathing. Option C, cooled extremities. Option D, unstable blood pressure. The correct answer is option A, increase in appetite. Appetite generally decreases or disappears as the body begins the dying process. Question 2. Which medical position is described as the patient's head being elevated with legs either bent or straight? Option A, a Fowler's position. Option B, Rose's position. Option C, Sims position. Option D, a Trendelenburg's position. The correct answer is option A, Fowler's position. Fowler's position involves the head of the bed being elevated at a 45 to 60 degree angle. Question 3. Which of these demonstrates proper body mechanics when helping to lift a resident in bed? Option A, bending at the waist with knees locked. Option B, bending at the knees and using leg muscles to lift. Option C, bending at the waist and using arm muscles. Option D, no bending needed while using arm muscles to lift. The correct answer is option B, bending at the knees and using leg muscles to lift. Using the large muscles of the legs rather than the back prevents injury to the caregiver. Question 4. What is the best use of an alcohol-based sanitizer? Option A, when hands are not visibly soiled. Option B, when hands are visibly soiled. Option C, when hands have blood from a cut. Option D, when helping with catheterization. The correct answer is option A, when hands are not visibly soiled. Sanitizers are effective for decontaminating hands that do not have visible dirt or biological fluids. Question 5. Which of these is incorrect in reference to wearing gloves? Option A, peel the glove away so it comes off inside out. Option B, wash your hands before and after removing gloves. Option C, always wear latex gloves because they are the most impermeable option. Option D, avoid letting the outer layer contact your skin during removal. The correct answer is option C, always wear latex gloves because they are the most impermeable option. Vinyl or nitrile gloves are often used because of the high prevalence of latex allergies. Question 6. You notice that your resident has difficulty breathing and count their respirations to be 30 per minute. What do you do? Option A, nothing because this is a normal finding. Option B, turn the oxygen up. Option C, help the resident rest and notify the nurse. Option D, lay the resident flat and tell them to breathe slowly. The correct answer is option C, help the resident rest and notify the nurse. A respiration rate of 30 is abnormally high and requires immediate nursing assessment. Question 7. Which of these is true about spirituality in a care facility? Option A, family members are responsible for bringing in church members. Option B, employees are obligated to share their own religious beliefs. Option C, assistants should share their ideas so the dying have hope. Option D, it is a resident's right to practice his or her own religious beliefs. The correct answer is option D, it is a resident's right to practice his or her own religious beliefs. Facilities are legally and ethically required to respect a resident's individual religious practices. Question 8. Which of these is true about cultural awareness in a care facility? Option A, it is ideal but not always practical due to staffing. Option B, cultural awareness must be a part of staff training for holistic care. Option C, it is sometimes sacrificed when it costs too much to implement. Option D, it is not practical in a large facility. The correct answer is option B, cultural awareness must be a part of staff training for holistic care. Providing care for the whole person requires understanding and respecting their cultural background. Question 9. A family asks for time to pray with a resident before a procedure. Which of these is not an acceptable response? Option A, give the family and resident privacy. Option B, ask if they have questions that might ease their worry. Option C, ask the family to leave so the procedure can start as scheduled. Option D, tell the family you will return shortly. The correct answer is option C, Ask the family to leave so the procedure can start as scheduled. Interfering with a resident's religious practice is a violation of their rights. Question 10. As a nursing assistant, which of these actions would discourage a resident from meeting their spiritual needs? Option A. Telling the resident you are not allowed to engage with them about beliefs. Option B. Sitting and listening when a resident tells you about an experience. Option C. Assisting when a resident asks to see a visiting pastor. Option D. Responding positively to a visitor's request for prayer. The correct answer is option A. Telling the resident you are not allowed to engage with them about beliefs. Dismissing a resident's spiritual concerns can cause them to feel isolated or ignored. Question 11. All of these could be described as positive benefits of religion except which of the following? Option A. Serving as a way for the resident to separate from his or her family. Option B. Helping to facilitate a sense of meaning and comfort. Option C. Improving health outcomes through a positive attitude. Option D. As a means for increasing tolerance to cope with difficulties. The correct answer is option A. Serving as a way for the resident to separate from his or her family. Religion typically provides support and community rather than causing isolation from family. Question 12. Talking to residents about spiritual beliefs can have an effect on which of the following? Option A. The resident's feeling of connectedness. Option B. The resident's mental health. Option C. Physical and mental health and feelings of connectedness. Option D. The resident's physical health only. The correct answer is option C. Physical and mental health and feelings of connectedness. Addressing spiritual needs supports the resident's overall well-being and emotional health. Question 13. Participation in religious activities can provide all of these benefits except which of the following? Option A. Reducing a resident's isolation. Option B. Increasing a resident's sense of belonging. Option C. Promoting social contact with others. Option D. Allowing more time for the assistant to get a break. The correct answer is option D. Allowing more time for the assistant to get a break. The goal of religious activity is to benefit the resident, not to provide staff convenience. Question 14. When encountering residents with diverse backgrounds, one action that helps provide effective care is to do what? Option A. Talk slowly and loudly so that you are understood. Option B. Avoid interactions until you feel totally comfortable. Option C. Ask a coworker to take over if the resident makes you uncomfortable. Option D. Recognize when stereotyping occurs and work to correct it. The correct answer is option D. Recognize when stereotyping occurs and work to correct it. Self-awareness and the avoidance of bias are critical for providing professional and equitable care. Question 15. Which of these is a positive way of dealing with cultural differences? Option A. Learn and use key words in the person's language or use visual aids. Option B. Choose a coworker most similar in beliefs to work with the resident. Option C. Realize that cultural differences are related to intellectual deficiencies. Option D. Ask family members to take over the difficult parts of care. The correct answer is option A. Learn and use key words in the person's language or use visual aids. Using bridge communication tools shows respect and improves the quality of care. Question 16. How is family an important part of cultural awareness? Option A. Spiritual beliefs may affect how much care the family allows. Option B. Cultures may interpret the role of caregivers differently than the care plan. Option C. Different cultures may have different expectations of gender roles. Option D. All of these are correct. The correct answer is option D. All of these are correct. Understanding family dynamics and cultural expectations is essential for a successful care plan. Question 17. A patient has been diagnosed with a terminal illness. What is the most appropriate action for the assistant? Option A. Share your own religious beliefs to give them hope. Option B. Offer to contact a pastor or spiritual leader if the patient desires it. Option C. Pray for the patient aloud so they can see you care. Option D. Avoid discussing the diagnosis unless the patient brings it up. The correct answer is option B. Offer to contact a pastor or spiritual leader if the patient desires it. Supporting the resident's specific spiritual requests is the correct professional approach. Question 18. What is the meaning of increasing cultural proficiency for healthcare workers? Option A. Diversity will change the job roles for the healthcare team. Option B. Diversity requires the team to work cohesively among different belief systems. Option C. Diversity in the workforce will make it much easier to work together. Option D. Diversity in the workforce will have little effect upon workers. The correct answer is option B. Diversity requires the team to work cohesively among different belief systems. A diverse team must understand and respect various cultural perspectives to provide effective care. Question 19. Which of these is the best way for an assistant to honor a resident's personal space? Option A. Explaining care and procedures in terms that the patient understands. Option B. Only talking to the patient when no one else is present. Option C. Having the family provide as much personal care as possible. Option D. Explaining care and procedures while respecting boundaries. The correct answer is option D. Explaining care and procedures while respecting boundaries. Respecting personal space involves clear communication and physical boundaries during care. Question 20. What is a key component of effective communication in care? Option A. Maintaining physical distance away from the patient. Option B. Learning everything about the patient's culture. Option C. Talking with a higher volume so the patient hears. Option D. The nursing assistant explaining care in terms the patient understands. The correct answer is option D. The nursing assistant explaining care in terms the patient understands. Ensuring the resident understands the care they are receiving is fundamental to communication. Question 21. One of the most basic ways a caregiver can provide spiritual and emotional care is by doing what? Option A. Asking if he or she needs more family visits. Option B. Asking if he or she has any questions. Option C. Asking if he or she needs a counselor. Option D. Asking if he or she is getting adequate food. The correct answer is option B. Asking if he or she has any questions. Inviting communication allows the resident to express their fears, needs, or concerns. Question 22. A Japanese man winces and looks away while you apply compression stockings. What is the best response? Option A. Assume that the patient is no longer in pain because he is not wincing now. Option B. Acknowledge that it can be painful and ask if he is in any pain. Option C. Tell the nurse that the patient needs pain medication immediately. Option D. Tell the patient he is being very brave during the procedure. The correct answer is option B. Acknowledge that it can be painful and ask if he is in any pain. Validating the resident's nonverbal cues for pain is the first step in providing comfort. Question 23. The term psychosocial needs generally refers to which of the following? Option A. Of physical and intellectual well-being. Option B. Emotional well-being only. Option C. Recreational well-being only. Option D. Emotional and recreational well-being. The correct answer is option D. Emotional and recreational well-being. Psychosocial needs encompass a person's mental, social, and emotional health. Question 24. Which of these is the least significant reason that adjusting to aging might be difficult? Option A. Loss of a spouse or significant other. Option B. Concerns about the impact of one's career choice. Option C. Dependency on daily medications to maintain health. Option D. Requiring help with activities of daily living. The correct answer is option B. Concerns about the impact of one's career choice. Grief, health changes, and loss of independence are typically much more stressful than past career choices. Question 25. Which of these descriptions represents a Western cultural view of health and wellness? Option A. Illness is caused by biological and medical sources. Option B. A treatment relies on herbal remedies dispensed by practitioners. Option C. Illness is due to supernatural or religious causes. Option D. Responsibility for health lays with one's cultural group. The correct answer is option A. Illness is caused by biological and medical sources. Western medicine typically focuses on scientific, biological causes for disease and illness. Question 26. What is the definition of the term spiritual distress? Option A, regretting the choices you have made in life. Option B, the feeling of loss of hope for the future. Option C, not being sure which religious group to belong to. Option D, the feeling that there is no God. The correct answer is option B, the feeling of loss of hope for the future. Spiritual distress is a state where a person's sense of purpose or hope is deeply challenged. Question 27. A resident has suffered a stroke and you are helping with ambulation. Where is the best position? Option A, in back of the resident. Option B, on the resident's unaffected side. Option C, in front of the resident. Option D, on the resident's side that has been affected by the stroke. The correct answer is option D, on the resident's side that has been affected by the stroke. Standing on the resident's weak side provides the most support and safety in case they stumble. Question 28. When performing care activities, when should gloves be worn? Option A, when you are feeding a resident. Option B, when you are helping with ambulation. Option C, when performing perineal care. Option D, when you are changing a resident's clothing. The correct answer is option C, when performing perineal care. Gloves are required whenever there is a potential for contact with body fluids. Question 29. A nurse asks you to perform something stat. This means you should do it when? Option A, as soon as possible. Option B, before your shift ends. Option C, within the next hour. Option D, immediately. The correct answer is option D, immediately. Stat is a medical term derived from the Latin word meaning at once. Question 30. In which of these examples would refusal to do a task be acceptable? Option A, a task that is not normally assigned to your shift. Option B, a task that you do not feel needs to be done. Option C, a task that you have already done many times today. Option D, a task that should not be done by a nursing assistant. The correct answer is option D, a task that should not be done by a nursing assistant. Nursing assistants must never perform tasks that are outside their legal scope of practice. Question 31. At the end of your shift, you discover your colleague is under the influence of alcohol. What do you do? Option A, tell the nurse in charge immediately. Option B, tell the colleague to go home and cover their shift. Option C, suggest they seek help through a support group. Option D, get them coffee and stay until they sober up. The correct answer is option A, tell the nurse in charge immediately. Reporting an impaired coworker is essential for resident safety and professional duty. Question 32. Documentation of a resident's fluid intake and output is measured in which standard unit? Option A, meters. Option B, milliliters. Option C, milligrams. Option D, ounces. The correct answer is option B, milliliters. Milliliters is the standard metric unit used for measuring liquid volume in healthcare. Question 33. You notice a resident is having difficulty breathing. What is your proper response? Option A, notify the nurse immediately. Option B, call the family contact member immediately. Option C, check back in a few minutes to see if it improves. Option D, wait in the room for a period of time. The correct answer is option A, notify the nurse immediately. Respiratory distress is an emergency that requires immediate notification of the licensed nurse. Question 34. Which team member matches resident socialization skills with resources? Option A, licensed practical nurse. Option B, social worker. Option C, a physician. Option D, chaplain. The correct answer is option B, social worker. Social workers assist with the psychosocial and resource coordination needs of residents. Question 35. Which of these statements is incorrect regarding cleaning a urinary drainage bag? Option A, wash your hands both before and after the procedure. Option B, use peroxide to cleanse the drain on the urinary bag. Option C, the bag should be kept below the level of the bladder. Option D, avoid touching the tube or catheter ends. The correct answer is option B, Use peroxide to cleanse the drain on the urinary bag. Alcohol wipes are typically used to clean the drainage port to prevent infection. Question 36. If you are unable to clean up a large spill yourself, what is the best alternative? Option A. Ask a resident to walk away from the area. Option B. Do not let any residents exit their rooms. Option C. Ask a resident to help you stop traffic. Option D. Block off the area from traffic. The correct answer is option D. Block off the area from traffic. Securing the area prevents accidents while waiting for maintenance to clean the spill. Question 37. A nursing assistant walks in on a patient who is having a seizure. Which action is first? Option A. Support the patient's head and move objects that could injure them. Option B. Call for the doctor immediately. Option C. Place a padded tongue blade in the patient's mouth. Option D. Restrain the patient so they do not harm themselves. The correct answer is option A. Support the patient's head and move objects that could injure them. Protecting the resident from injury and the environment is the first priority during a seizure. Question 38. Which of these conditions requires immediate reporting to the nurse? Option A. A sudden increase in urinary output. Option B. Occasional incontinence. Option C. A decrease in appetite. Option D. A difficulty breathing. The correct answer is option D. Difficulty breathing. Difficulty breathing is a life-threatening symptom that requires immediate intervention.